Hey everyone, and welcome. We're diving deep into the world of surgery today. Buckle up, because we're talking about some seriously cutting-edge stuff. Think robots in the OR, split-second decisions in the ER, even what happens after surgery is changing. And the best part, we're getting all these insights straight from a podcast for surgeons, so you know it's the real deal.
And that's what's so cool about this source. It's like
Right.
they're not afraid to get into the nitty-gritty details. It's like having a front row seat to the future of surgery. You know what I mean?
Totally. And speaking of front row seats, they jump right into a topic that has everyone talking robotic assisted surgery, but not just anywhere. We're talking colorectal surgery.
Yeah, and that's where it gets really interesting because the pelvis, well, let's just say it's a tight space to work in.
Yeah, not a lot of wiggle room down there.
Exactly. So being able to operate with that level of precision, thanks to these robotic systems and their fancy cameras and instruments, well, it's kind of game changer. Less risk of damaging surrounding tissues, potentially faster recoveries.
Okay, so less pain, faster healing. That's something we can all get behind. But let's be real. Is this robotic surgery the magic solution everyone's making it out to be?
It definitely has the potential, but let's not get ahead of ourselves. We're still in the early stages, gathering long-term data. Plus, these robotic systems require specialized training, which takes time and resources. So it's not just about the technology itself, it's about the skill of the surgeon using it.
That makes total sense. It's like any tool, right?
Yeah.
It's only as good as the person wielding it. But hey, speaking of high-stakes situations, this podcast takes us from the meticulously planned world of robotic surgery to a place where things get real, really fast, the ER. They paint this picture of blunt abdominal trauma. Sounds intense.
It's about as intense as it gets in surgery. You've got a patient potentially bleeding internally, their vital signs going haywire,
Right.
and you have to make life or death decisions, like right now.
Talk about pressure. So walk us through it. What's the first move in a situation like that?
First things first, stabilization. You've got to control any bleeding, support their blood pressure, all while you're trying to figure out exactly where the bleeding is coming from.
It's like a race against time, trying to put the pieces together.
Exactly. And that's where things like fast exams come in, basically a rapid ultrasound or even something called a DPL, where they're looking for blood in the abdominal cavity. They're searching for that internal bleeding, but then what?
Yeah, what happens next? Do they just open the patient up and start trying to fix everything?
Well, if they find a significant bleed, then yeah, it's time for surgery.
Hmm.
But here's where it gets interesting. Sometimes the goal isn't about perfectly repairing everything right away. It's about damage control.
Damage control? What do you mean? I always thought surgery was all about putting things back together.
In the ER, with a critically injured patient, it's about taking quick, potentially life-saving actions. So that might involve packing bleeding areas to control hemorrhage, temporarily closing the abdomen to prevent further contamination, and then, once the patient is stable, they go back in for more definitive repairs.
Wow, so it's like a two-part process sometimes. First, you stop the bleeding and stabilize, then you go back and fix everything properly. That's fascinating. It really changes my perspective on how surgeons operate, especially in those high-pressure situations. But even outside of the ER, surgery isn't just about what happens in the operating room, is it? Recovery plays a huge role too.
You got it. Minimizing complications after surgery, that's a huge part of what surgeons do. And this podcast episode really emphasizes that, especially when it comes to something called DVT.
DVT. No, that's not ringing any bells for me. What is that?
A DVT, or deep vein thrombosis, basically. It's a blood clot that can form after surgery, especially after longer procedures or in patients who might be at higher risk.
Oh, wow. And I'm assuming that's not a good thing.
Not good at all. It can be really dangerous if it breaks loose and travels to the lungs, causing a pulmonary embolism. That's why surgeons take it so seriously.
So how do they prevent that from happening?
They've got a two-pronged approach. They use medications like heparin, which is a blood thinner, to help prevent those clots from forming in the first place. But they also use mechanical methods, like compression devices that go on your legs. These help to keep the blood flowing, which makes it harder for clots to form.
So it's all about being proactive, taking these steps to reduce the risk as much as possible.
Exactly. And speaking of reducing risks and improving recovery, this episode dives into something called the ERAS protocol, especially for patients having colorectal surgery.
ERS. Okay, now you're really speaking a different language. Break that down for me.
Sure. ERS stands for Enhanced Recovery After Surgery. It's this whole new way of thinking about how we can help patients recover faster and with fewer complications after surgery.
So what's the secret sauce? What makes ERS so special?
Well, it all starts even before surgery. Instead of that old school advice to avoid food or drinks for hours before surgery, they're now encouraging patients to carb load beforehand.
Great, you're telling me they want people to eat carbs before going under the knife? That seems counterintuitive.
It might sound strange, but it actually gives the body the energy it needs to heal and recover faster. It's like fueling up for a big event, except in this case, the big event is surgery.
That's wild. Okay, so carb loading before surgery, got it. What else is involved in this ERS protocol?
Well, during the surgery itself, they focus on minimally invasive techniques whenever possible, meaning smaller incisions, less trauma to the body. They're also very careful about managing fluids and pain, so patients are more comfortable and bounce back faster.
That all makes sense, but what about after the surgery is over? How does ERS change things then?
This is where it gets really interesting. They actually encourage patients to start eating soon after surgery, like really soon.
Hold on, I thought after surgery, especially abdominal surgery, you're supposed to take it easy on your stomach. No food or drink for a while, right?
That used to be the standard, but ERS throws that out the window. It turns out that getting the digestive system moving again as soon as possible helps with recovery.
So no more starving yourself after surgery?
Not necessarily. It really depends on the patient and the type of surgery, but the idea is to get the digestive system back on track sooner rather than later. And speaking of getting things moving, another key part of ERS is early mobilization, meaning they get patients up and walking around as soon as it's safe.
Really? I always thought after a big surgery, rest was the best medicine. Just stay in bed and let your body heal.
Well, it turns out that too much bed rest can actually hinder recovery. By getting patients up and moving around, even if it's just short walks at first, it helps prevent complications like blood clots, pneumonia, muscle weakness, all sorts of things.
So it's about finding that sweet spot between rest and activity.
Exactly. And that's a big part of what ERAS is all about, challenging those old assumptions about surgery and recovery.
It's amazing how much the world of medicine is always evolving. But you know what else caught my attention in this podcast? They start talking about something called ECMO, and I have to admit, it sounds pretty futuristic to me. What is ECMO exactly?
So ECMO stands for extracorporeal membrane oxygenation. Essentially, it's a way to provide life support for patients whose lungs are failing.
So it's like a machine that breathes for you.
That's a good way to put it. Basically, the ECMO machine takes over the work of the lungs, giving them a chance to rest and heal.
Wow, that's incredible. In what kind of situations would you use something as advanced as ECMO? Is it for any lung problem or is it reserved for really serious cases?
It's definitely not something they use lightly. ECMO is typically reserved for the most critical cases, like severe ARDS, which is a type of lung failure, really bad cases of pneumonia, or even certain heart conditions that are affecting the lungs. We're talking about situations where conventional treatments like a ventilator just aren't enough.
So it's like a last line of defense when someone's lungs are failing. But it sounds like ECMO itself is a pretty complex procedure.
Oh, absolutely. And this podcast doesn't shy away from that complexity. They talk about the different types of ECMO, how they work, the monitoring involved. It's really fascinating. But one thing that really struck me was how they emphasize that ECMO is not a cure.
Oh, so it's more like buying time, giving the body a chance to heal.
Exactly.
Yeah.
ECMO is a bridge, but sometimes that bridge leads to some really tough decisions.
Mhm.
What happens if a patient's condition doesn't improve enough to come off of ECMO?
Yeah, that is a heavy question. It makes you think about the ethical considerations, right? I mean, when do you keep fighting and when do you let go? It's a lot to grapple with, but that's what's so thought-provoking about this podcast. It doesn't shy away from those tough conversations. It forces you to think beyond the technical aspects of surgery and consider the human side of it all.
Exactly. And, that reminds me of something else they touched on in this episode. They were talking about rectal cancer surgery and how much the approaches have changed over the years.
Oh, yeah, that's right. They were saying something about how surgeons are always striving to find that balance, right? Removing the cancer effectively, but also preserving quality of life as much as possible.
Absolutely.
Yeah.
It's not just about getting rid of the tumor. It's about minimizing the impact on the patient's life afterwards. And that's where all these advancements in surgical techniques come into play. Things like minimally invasive approaches, robotic-assisted surgery, they're all aimed at improving outcomes for the patient, not just in terms of survival, but also quality of life.
It makes you realize that surgery is so much more than just a physical act, right? It's about compassion, empathy, really understanding the patient's perspective. But I'm curious, they mentioned a few different surgical options for rectal cancer. Can you break those down for me? I'm not really familiar with the specifics.
Sure. So they talked about a procedure called a low anterior resection, or LAR for short. This is often the preferred approach for tumors that are located higher up in the rectum.
And what makes LAR a good option in those cases? What's the advantage?
Well, with an LAR, surgeons can often remove the cancerous section of the rectum while preserving the anal sphincter.
And remind me again, why is that so important?
The anal sphincter is what gives you control over your bowel movements. So by preserving it, patients are much less likely to need a permanent colostomy, which obviously has a big impact on their quality of life.
Oh, right. That makes total sense. Preserving bowel control after surgery is a huge deal. But what about tumors that are located lower down in the rectum, closer to the anus? They mentioned another procedure for those situations, right?
Yeah, for lower rectal tumors, surgeons might need to perform a procedure called an abdominoperineal resection, or APR, and that one is a bit more involved.
More involved in what way?
Well, with an APR, they actually have to remove the entire rectum and anus in order to get all of the cancer. And because of that, patients will need to have a permanent colostomy.
Oh, wow. I can see why that would be a last resort. It's incredible how surgeons have to weigh all these factors when deciding on the best approach for each patient, isn't it? They're constantly balancing the need to remove the cancer with the desire to preserve as much function and quality of life as possible.
Exactly. And that's what makes this field so challenging and rewarding at the same time. It's not just about mastering the technical skills of surgery. It's about understanding the whole patient, their individual needs, their fears, their hopes. It's about making decisions together as a team to achieve the best possible outcome.
Beautifully said. And speaking of teamwork, we've been doing a lot of talking, and I'm curious to hear from our listeners. What advancements in surgery have you witnessed in your lifetime? What possibilities or concerns do they spark in your mind? Share your thoughts and keep those questions alive. Until next time, happy exploring. But what I'm curious about is ECMO sounds incredibly resource intensive. What happens if a patient's condition doesn't improve enough to come off it?
Yeah, that's a tough one, you know? Yeah. You've hit on one of those big ethical challenges in medicine. ECMO, as amazing as it is, it's not a magic bullet. It's a bridge, and sometimes that bridge, well, it leads to some difficult choices.
It's not always a straightforward path to recovery.
Exactly. Doctors, patients, families, they might end up facing some really, really difficult decisions about whether to continue that life support or not, trying to balance hope with the reality of the situation.
It's never easy, those kinds of decisions. And speaking of complex decisions, this episode also dives into how surgeons are tackling rectal cancer, and it sounds like the approaches have come a long way.
Oh yeah, definitely. Rectal cancer surgery, it's a great example of how surgery is always evolving, always looking for ways to be less invasive, to preserve more, quality of life for the patient.
So what are we talking about here? What are the main surgical options for rectal cancer?
Well, it all depends, right? Depends on the tumor itself, where it's located, how far along it is. But for tumors that are higher up in the rectum, a low anterior resection, or LAR, is often the way to go.
And what's the advantage of that approach? Why LAR over other options?
So the great thing about an LAR is that in many cases, it lets surgeons take out the cancerous part, but they can often preserve the anal sphincter.
Now, that's important for obvious reasons.
You got it. Bowel control, that's huge for quality of life. No one wants to deal with a colostomy bag if they can avoid it.
Absolutely. So LAR is a win-win when possible. But what about tumors that are lower down closer to the anus? Those are trickier, right?
Yeah, those lower rectal tumors, those can be tougher. Surgeons might have to consider a different approach, something called an abdominoperineal resection, or APR.
And that one's a bit more involved.
It is, yeah, an APR. It's a bigger surgery. It involves removing the rectum and the anus, which unfortunately means the patient will need to have a permanent colostomy.
I can see why that would be a last resort. It's a big adjustment to life after surgery.
Absolutely. It's not a decision that's made lightly, believe me. But sometimes an APR, it might be the best option to make sure they get all of the cancer, to give the patient the best chance. It really highlights how surgeons have to weigh those benefits and risks, always trying to find that balance, that best possible path for each individual patient.
It's about so much more than just technical skill, isn't it? It's about judgment, experience, and really understanding the individual patient's needs.
You said it. And, it's amazing to see how technology is changing the game. Even for complex procedures like this podcast, they were talking about how minimally invasive techniques are being used more and more in rectal cancer surgery too.
Really? So even for something as intricate as rectal surgery, they're able to do it laparoscopically or even with robotic assistance?
Absolutely. And it's not just about the cool factor of the technology, right? It's about what that technology allows surgeons to do: smaller incisions, less pain, faster recovery times, potentially fewer complications down the line.
It's incredible how innovation keeps pushing the boundaries of what's possible. And it's not just in the OR, is it? It's that whole approach to the patient journey, like we talked about with ERAs.
Exactly. And this source, even though it's geared towards surgeons, it really highlights that shift. It's like this whole movement toward a more holistic view of surgical care, recognizing that what happens before and after surgery is just as important as the surgery itself.
It's about optimizing recovery, minimizing complications, really thinking about the whole picture. It's a completely different mindset, isn't it?
Absolutely. And that's what's so exciting to see. This source, it gives us this really valuable peek behind the curtain. It shows us how surgery is evolving from this single event into this whole continuum of care.
It's about bringing together all these advancements, the technology, the techniques, the focus on recovery, and weaving them together to create this more patient-centered approach.
Exactly. And at the heart of it, it's about recognizing that behind every surgery, there's a person with their own unique needs and fears and hopes for the future. And that brings us to another fascinating part of this deep dive, the future of surgery. This source, even though it's grounded in the here and now, it's constantly hinting at the fact that these techniques, this technology, it's evolving at an incredible pace.
Which makes you wonder, what does the future hold? What new frontiers will we be exploring 10, 20 years down the line?
It's exciting and maybe a little bit daunting at the same time.
It really is mind-blowing to think about, isn't it? What if robots could, instead of just assisting, actually perform certain procedures, like on their own, with even greater precision than we can with our human hands?
That's some next level stuff right there. You're talking about robots doing surgery solo.
Imagine the possibilities, right? Think about those super delicate surgeries or operating in those really hard to reach places even. Or what about remote surgery? Like, what if distance wasn't even a factor anymore? It's like something straight out of a sci-fi movie. But it does make you wonder, what happens to the surgeon's role in all of this? If the robots are doing the actual operating.
That's the big question, isn't it? As this technology, it keeps advancing, it's going to reshape the whole landscape of healthcare. It's already happening. Who knows? Maybe we'll see a future where surgeons, they're more like pilots. They're overseeing procedures, guiding the technology, using their expertise, but from a console.
Wow, that would be a huge shift.
Ooh.
But it makes sense, right? Like, we're already seeing it in other fields. And, it brings up a lot of questions, too. Like, how do you even train surgeons for that kind of world? And what does it mean for that doctor-patient relationship when technology starts taking center stage? It's both exciting and a little bit, unnerving at the same time.
Absolutely. And it's not just about robots either.
Yeah.
It's about pushing those boundaries, seeing what's possible. We talked about ECMO earlier. Imagine as we develop even more advanced life support systems, we're going to face new ethical questions that we haven't even thought of yet.
It's like opening Pandora's box, right?
Yeah.
Every time we have this breakthrough, we get these new abilities, but then it's like, okay, now what? How do we use this responsibly? How do we make sure these technologies, especially when you're talking about life and death, how do we make sure they're used ethically and that everyone has access to them? It's a lot to consider.
It really is. And this podcast, even though it focuses on the technical stuff, the surgery itself, it always seems to circle back to those bigger questions.
Yeah.
It reminds us that surgery, it's not just about procedures, it's about people. It's about their lives. It's about well-being.
At the end of the day, it's about making these huge decisions, sometimes life or death decisions, in a way that honors the patient as a person, their values, their wishes, and that human connection. I feel like that's at the heart of everything surgeons do, wouldn't you say?
Absolutely. And that's what makes this field so incredibly fascinating. It's this constant interplay,
Mm-hmm.
You get this cutting edge technology, but it's paired with this deep compassion, this desire to help, to heal. It's about pushing the limits of what's possible, but never losing sight of the human element.
Well said. And to our listeners, as we wrap up this deep dive, think about this. What advancements in surgery have you seen in your lifetime? What possibilities or concerns do they spark in your mind? These are questions worth pondering, and that's what we hope this show inspires: curiosity, critical thinking, and a passion for exploring the ever-evolving world of medicine. For the deep dive, I'm your host, signing off. Until next time.